I'd like to address a few differences between the first wave and the second wave that we're seeing now. First of all, younger people are suffering more than they were during the first wave. People were getting infected regardless of age, but usually the younger age group would escape with minor asymptomatic illness. Now they are getting pneumonia, ARDS. People in their 20s and 30s are dying in GMC. So it is something to be worried about. Secondly, is something that we don't really know why, but it's happening regardless, is RT-PCR reports are repeatedly coming negative, but patients are still having severe lung involvement with CT scores of above 16 out of 25, sometimes even above 20. These people are not microbiologically positive, but they are getting admitted and they are dying due to ARDS and due to lung involvement and pneumonias, and that is something that people need to be aware about. Just because your RT-PCR negative doesn't mean that you can go out and enjoy and live your life like you were before, because you could still be positive, you could still get really seriously ill, and you could give that infection to other people as well. The third thing is that there are a lot of atypical symptoms which we are seeing on a daily basis. Now that list includes conjunctivitis, abdominal pain, diarrhea, loose motions, and people are coming not just with lung involvement and breathlessness, but they are coming as emergency patients where their BPs are very low and extremely low, and some patients are even dying of shock because of low BP. So yes, there is a lot to worry about at the second wave. We are in this for more than a year now, but it's almost as if we are dealing with a completely new virus. But fear not, there is still hope. If we all work together and we all join hands and fight this together, we can still get out of it. In today's video, I'm going to address mask wearing and proper mask etiquette. 3 different kind of masks available are N95, a surgical triple layer mask, and a normal cloth mask. So according to new guidelines, if you're wearing an N95 mask, it's sufficient. You don't need anything else over this. If you're wearing a cloth mask by itself or a surgical mask by itself, it's not enough to protect you or other people from you. So you're going to have to combine them together. If you're double masking, you have to wear the surgical mask underneath and the normal cloth mask above that. This will protect you from around 80 to 85% of particles. Now comes the most important part of mask etiquette. How do you remove your mask safely after going about your day? So now I've come home and all the viral particles are all over my mask. So do I drag it down? No. You have to reach behind your ears and remove it from behind your ears, being careful not to touch the mask at all. Because if you drag it down, your neck has been exposed all this time. It will come in contact with all the germs and the virus particles on your neck, and then you'll drag it back up and shove it up your nose. So once you've removed your mask safely, you have to wash your cloth masks. If this is being used for more than 6 hours, you have to discard it. Or if it's wet. If it's wet, it's useless. Another thing that I personally like to do is to break off the thread from one side before discarding surgical masks like this, and make sure that it's not in a loop, because when this lands up in our oceans or in trash cans, it tends to get entangled with animals like turtles or fishes and choke them to death. Another thing that's important to remember is it's not about the filtration of the mask. You could have an N95 mask but still have a lot of leakage around this area or this area when you breathe in deeply or breathe out deeply. So what's most important is the fit of the mask on your face. It should be in contact with the skin around this area at all times. So that's why generally we don't put 2 surgical masks on top of each other. Due to so much resistance, the air is more likely to leak out from this area. It is most effective if you have a surgical mask with a cloth mask on top, because the cloth mask is what's going to press it to your face and make sure that it doesn't leak from the side. All the best.